Hi, welcome to our Tuesday night talk at Optima Health and Vitality and Optima Medical. I'm Dr. Bircher and this is...
I'm Deb Tequist, nurse practitioner.
And we give classes every month, sometimes 2 a month. I've been doing that for 38 years. And we try to educate people on natural healthcare methods and see if that's something that would work for them to get to the level of health that they desire. Tonight is on regenerative medicine, and we're going to be a little bit about me. I started doing this 38 years ago, and what I've moved to over the years is I kind of specializing in chiropractic neurology and how the nervous system controls everything. And there's another group called functional neurology. It's just how to measure neurological function and how to improve neurological function to prevent disease. The other main thing we do is functional medicine, which is doing nutritional programs and detox programs based on blood tests, urine tests, saliva tests, hormone tests. So we try to figure out how your body chemistry and metabolism is working, and then we can do things to help improve that. I'm a member of the American Functional Neurology Institute, the Institute of Functional Medicine, American Chiropractic Association, just various associations that have to do with improving human health in as many natural ways as possible. And the main thrust of the Institute of Functional Medicine is to try to find the root cause of disease, so we can do something at the cause to improve function and again prevent disease. And your experience?
Yeah. I'm a board certified family nurse practitioner as well as a geriatric nurse practitioner. I've got experience in both clinic, community, and long-term care, as well as corrections and integrative and functional medicine. I have a passion for a team approach towards patient care to obtain their best possible health and wellness. I'm a member of the American Academy of Ozone Therapy, a member of the Medical Integration, and a member of the OrthoB Institute, as well as the American Academy of Family Practitioners. I was trained by a family surgeon who taught me joint injections, and as well as a lot of surgical techniques. And I was also trained by internal medicine, so I've got a very good background to join Optima Health.
Yes, and tell us a little bit more about, you went to the Orthobiologic Institute training in Chicago.
Yes, where I learned how to do more fine-tune my injection skills to tendons, ligaments, and even nerves on cadavers. So we had a very good experience. So over my years of experience, I've done hundreds of injections.
Okay, so tonight is going to be about regenerative medicine, the process of replacing or regenerating human cell, tissue, or organs to restore or establish normal function. And as we get older, we know that function doesn't work as well as it used to. And the way our bodies normally work is that throughout our lives, our bodies are making new cells. So every few years, all the cells in your body are replaced by new ones. And if you don't do anything to improve the quality of your new cells, the new cells will be like the old ones, or they will tend to go downhill. And so what we try to do is find out what does it take to help your body make new cells that are healthier than the old ones, which will improve function, improve your health, and prevent disease. So that's the main thrust of, again, functional medicine. The purpose of this class is to inform you about natural healing systems that are available at this clinic, to answer questions at the end, so we'll take some questions at the end, so that you can make informed choices in the type of health care that will get you the best results that you desire. And tonight, we're focusing on functional regenerative medicine. So, for example, we're going to talk about our knee pain program, but the basic protocols that we're talking about for the knee pain program apply to all large joints, shoulders, hips. I'm just using the knee as an example because that's the program that we've been doing the longest. We've been doing it for years, very successful, using functional neurology, traction, laser, rebuilder, nutrition and rehab, trigenics, which is a functional neurological technique to try to get muscle function to improve and balance. A normal program that we've been doing in the past, which is very successful, is a year-long program, but we've taken people with knees where they were on walkers, couldn't get around, and have improved their knees to the point where they can get around without walkers and get around well. They're not brand new knees, but they can function much better. And tonight we're going to talk about if we add regenerative medicine injections into those joints, you can speed the healing process by 3 to 4 times, and we get longer lasting results. So this is the common question that I get from people is, why do joints wear out? And this is just some examples why. Lack of motion, lack of nutrients, and nutrients in, waste out of the joint, muscle imbalance, and I put feel yours on there. So when you have a muscle imbalance, that leads to improper movement. So for instance, a knee is a one-way joint. So this is the bottom and top of the knee. When you bend your knee, it should track straight. Your lower leg and your knee will go straight back and forth. If this muscle on this side of your thigh is stronger than the muscle on this side, which I had somebody just today with that situation, then what happens is that every time you bend your knee, this muscle pulls the lower leg off to one side. Every time you bend your knee, if this muscle out here is stronger than this side, the knee is going to move out just a little bit, and it's going to wear this side of the knee faster, so the cartilage wears out faster. And then the other thing that happens is, as the muscles around the knee get tighter, and I've challenged people to do this, if I go around and press on people's knees, and how many people will jump out of their chairs, because the muscles get tight over time. And the knee is a closed joint. There's no blood supply inside the joint. And so when the muscles around the knee get tighter, they interfere with the process of bringing nutrients in and bringing waste out. Because a normal functioning knee, when you bend it, it compresses bursa to exude synovial fluid to feed and lubricate the joint. And then when you straighten the knee, it opens the joint up and allows nutrients in, and then when you compress the knee, it pushes the waste out. Well, when you have muscles around your knee that are too tight, that knee never gets to open and close like it's supposed to, so the nutrients don't get in, waste don't get out as well, and the knee literally just wears out over time. And the statistic on the top of that page, 20% of the population over 45 has osteoarthritis, and it's growing. And the reason for osteoarthritis is that the nutrients aren't getting in, wastes aren't getting out because of muscle imbalance, and the knee just literally wears down. So the statistics, which I think are amazing, in the U.S. last year, there was 1 million knee and hip replacements in 1 year. And that's projected by the CDC to increase to 4 million by 2030. A knee or hip replacement, on average, costs $50,000. So if you add up the numbers, 1 million a year at $50,000 a piece is a lot of money. And what we're saying is that we can do things to help prevent the need for knee surgery. I have watched a knee surgery, and I'm very impressed by modern surgical techniques. But what we're saying is that ideally we'd like to prevent the need for it. And then if we find somebody that really needs it, I recommend that you go get it. And I think that surgeons do a relatively good job at knee replacements and hip replacements. But our system is to try to help prevent those. These are some of the things that we do. Our previous knee pain program that we've been doing for years, we would check the nerve supply from the lower back and the brain to the knee. Muscle imbalance I just talked about. Laser is one of the therapies that we'd use on the knee program. Ultrasound. Hakomet is an electrical therapy. Pulse electromagnetic field therapy, where we put these pads on either side of the knee and we run an electromagnetic field to charge the knee up so that the cells will draw in nutrients. Rebuilder is an electrical technique to rebuild the nerves to the knee. And rehab, to rehab those muscles, traction in the lower back to see if it, sometimes the lower back needs traction to open up those nerves to the knee. And we have testimonials, and we have video testimonials of a lot of people over the years that have been doing our knee pain program and have had very good results. And we have those available if somebody would like to see those. So here's the first level of our now regenerative medicine program that we're adding to our knee pain program, and I'll let you explain those.
Okay, so the first level is Prolozone, which is vitamins and minerals and natural anti-inflammatory medications and homeopathic medications, along with ozone, which is injected into your knee or your joint.
Any joint, yeah.
Any joint. And this helps promote the healing process through adding oxygen to the joint as well as vitamins and minerals to help begin the healing process.
So it stimulates the healing process.
Yep.
Because like the knee, like I talked about, if it's the muscles have been tight, it hasn't moved properly for a while, nutrients haven't been getting in, waste haven't been getting out. By putting those things in, you're getting nutrients in there to wake that joint up and stimulate the healing process.
As well as ozone helps open up the joint to let those natural anti-inflammatories in, as well as the vitamins and minerals to help the healing process.
And then ozone breaks down to oxygen, which feeds the tissues that they need to make energy to heal. The next level
is PRP, which is known as platelet-rich plasma. Platelets are taken from your blood. We take about 20 mils of blood and we spin it down, and then we draw off the serum, which contains platelets and many other things. And this has been done for over 30 years to regenerate new bone, ligaments, tendons, and cartilage. It's been using in hospitals all over the world. Thousands of peer-reviewed studies have been done. Our main use is joint generation. We can also use it in other areas like skin, hair regrowth, to help with wrinkle reductions in your face, skin atrophy in your hands. We can help put get new cartilage growth in here. It contains growth factors that can initiate the process of growing new cells, and it attracts your own stem cells from your body to that site where we inject.
There's not a lot of stem cells in the platelet-rich plasma. It's primarily platelets, but the platelets, when they come to an area to start the healing process, it normally attracts stem cells, your own stem cells that are floating around in your bloodstream.
It sends out a chemical stimulus to draw the stem cells to that area.
Yes. So this is just some information about what is a stem cell, and this is a study that was done in the U.S. The first part of this talks about a study that was done in the U.S., and one of the test sites was over in Minneapolis. And what they did was they took people who had bad knees and bad cartilage in their knee, and they had knee surgery, and then they put stem cells into the knee, and then they followed up for 2 years, and the conclusion was that 24% of people improved cartilage by at least 15%, and no one in the control group did this. So it doesn't sound like a huge increase, but any increase when you have a knee that the cartilage is wearing out and disappearing, if you could increase that by 15%, that's a big deal. And then if you add Prolozone and PRP and the other therapies we do, that number goes higher in our experience. And also they've been using stem cell parts in Japan for 7 years, in Germany for 3 years with very good results. So it's being done around the world, and there's lots of research behind it, and you can look on PubMed where this study came from. This came from 2014, and it was a published double-blind, controlled study that is the gold standard of research.
The third level is human tissue cell transplant. This is collected from human amniotic membranes, fluid placenta, or the Wharton's jelly. These cells have no antigens and do not require any cross-matching like if you would have a blood transfusion. The products can contain a small fraction of red blood cells, however, no adverse reactions have been reported in this country or any other country. Harvest info, the tissue is collected safely at facilities around the U.S. Donors are between the ages of 18 and 35 and are diagnosed as healthy and have no prior use of medications or other chemical substances. Even tattoos are forbidden. If you have a tattoo, you cannot be a donor. Careful history is also taken regarding their social life as well as their medical history. Wharton's jelly, it's part of the umbilical cord tissue and part of the umbilical cord vein and artery. And Wharton's jelly is like the outer layer of tissue, and that's what they use to harvest the cells from.
And the Wharton's jelly has many things in it, including hyaluronic acid, cytokines,
growth
factors, but that's where most of the stem cells are. So that's why they use that. That's what we use primarily.
And that product is called Corcyte. It's minimally manipulated Wharton's jelly product. It's gelatinous or like jello. It's used to cushion the artery and the veins of the umbilical cord. It contains proteins, periocytes, kinocytes, cytochemokines, as well as growth factors. Some common misconceptions that it's illegal in the U.S. This is false. There are regulations in the U.S., but they are not illegal. They come from dead babies. This is not true. They are only embryonic cells, not what we are using in any of our therapies. They have to go overseas to get the real stem cells. That's also false. The issue is how the stem cells are grown or expanded in the U.S. versus overseas. Overseas, they can culture the cells, where in the U.S. we cannot. Benefits of regenerative therapies: there's no ethical concerns, no harm to the donors, and no fetal concerns. These are from live births. Immune privileged, they do not generate a reaction, so no cross-matching or HLA typing is required. Found in many tissues, so it's multi-potent. We use your own body's defense mechanism, and there's no toxins or side effects like pharmaceuticals if you would take a drug. Safety of allografts: they're collected from human amniotic membranes and fluid placenta and Wharton's jelly. These cells have no antigens and do not require ABO typing, like we said before. What are stem cells? Stem cells are unspecialized or undifferentiated cells that have two characteristics. They can make copies of themselves or multiply and divide, and they can change into different types of cells depending on what the body tells them to do. So they can make cartilage, they can make bone, they can make vessels, they can make nerves, depending on what's needed at the site where they're injected. Types of stem cells: there's embryonic, can become any type of cell, can develop into a complete organism. Adult stem cells, that's found in bone marrow, adipose, or fat. Umbilical cord can become a number of different tissues. They have a limited amount of regenerative cycles. The induced pluripotent adult stem cells are that's programmed to act like embryonic stem cells, not used yet in clinical settings. It's only in research at this point.
So there's research going on in Wisconsin. University of Wisconsin-Madison's been doing stem cell research for a while, and that's what they are doing, as far as I know, is the induced pluripotent type stem cells. And that's still in the research stages. The adult stem cells is what we use. Those work the best in our opinion. And then they come from different places, like it says on there. And according to the FDA, if what we do is called human tissue cell transplant, because we're using umbilical cord stem cells. And so we have to call it human tissue cell transplant because they're transplanted from somebody else and using them. So I had that done myself in my right hip and my right wrist, and I had chronic problems there for years with my wrist and my hip. Had the human tissue cell transplant with stem cells in them and had very good results. We've been doing them with patients since the first of the year, and they've been being done around the world, like I said earlier, for years, and in the US for many years. There are thousands of clinics around the country doing this with good results. And so the wording is important, that stem cell therapy is, according to the FDA, it is when you take stem cells from that person, from their bone marrow, where you take, and they commonly take it from their hip. You can take it, spin it down from adipose tissue also, but there's not very many in adipose, so it doesn't work very well. But they spin those out and take stem cells out of the bone marrow and put them in a knee, for instance. That's called stem cell therapy because the stem cells are coming from you, that person. And since we're getting them from someone else or donated, we have to call them human tissue cell transplants. So that's just kind of the wording that the FDA requires us to use.
So the safety regulations, the harvest procedures follow the FDA guideline 21 CFR Part 1271 and the American Association of Tissue Banks rules and guidelines. The FDA doesn't regulate the actual use of our products, but as it does the testing and the handling, those they regulate. As of December of 2017, the guidelines and the FDA rulings are out that have given companies 36 months to ensure that the products meet the pre-market review process. And testing is similar to that of blood products used in transfusions.
So basically, a common question people ask is, are these FDA approved? And the answer to that, from the FDA definition, is true, they are. Because the FDA was originally, their job was to ensure safety of devices like a knee transplant, the metal that's put in your knee, the FDA has to approve that that's a safe piece of equipment to put in somebody's body. The same thing with these human tissue cell transplants. There are FDA guidelines that have to be followed by the company that we get ours from, and so they definitely do follow FDA rules, FDA regulated, and what they don't do is they don't tell you what to do with them. What the FDA does is they regulate to ensure that what we have is safe to put in somebody's knee or shoulder or whatever it is. So the answer to, is it FDA approved? Yes, it is, but I'm just defining what that means. So it's important that we use, proper words, like I just talked about, that the word stem cell is therapy means that's taken from you, whereas if it's from somebody else, it's human tissue cell transplant. And then it's important, the FDA also says that there are rules about what we can say, and I agree with those rules. It's like, don't overpromise outcomes. We can't promise that these human tissue cell transplants that contain stem cells are going to fix everything. It's cells that help your body to build new cells, but can we guarantee it's going to work? We can't do that. But we do know that if you couple the injections with lifestyle modification, losing weight, better diet, adding nutrients, getting good nerve supply to the knee, rehabbing the muscles if there's a muscle imbalance, the things that we talked about before. So that's the important part that the FDA wants us to, if we're going to use them, we have to inform people properly so we can have what's called informed consent. We have an informed consent form where we review those things and people sign to say that they understand all that. And these are another part of it, that something is taken from stem cells that can be used IV.
Which is called exosomes. Those are microvesicles which are within the human tissue cell or the stem cell, and it's involved in the cell-to-cell communication, which draws more cells to the site. It's from the placenta, derived from the mesocomial stem cell. It's not a cellular, there's no nucleus, there's no DNA in these vesicles. It helps direct the patient's own stem cells to restore the tissue. So it just basically sends out a signal that says, come here, come to this site, this is where we need you. And it helps modulate anti-inflammatory healing process, so it helps get the ball rolling.
So the next question is, people have, am I somebody that this would help? And so these are the things that we go through to try to decide if this person is a good candidate to do these therapies, which is prolozone, PRP, or human tissue cell transplants.
So overall, there's very few contraindications to injecting a patient. You will very likely do no harm in any circumstance. The approval process is more for outcome optimization. Must consider the realistic outcome of expectations. If you have bone on bone, you've got severe degenerative arthritis, we need to be upfront with you and say the potential of success is probably on the lower side versus if you had a brand new injury or a torn meniscus where you would have a better outcome. And if they're overweight, the number one reason for treatment failure is that we need to help address the weight loss issue at the time of the injection, that in order to get the best outcome they need to lose weight. Medical approval considerations, what is the history state, how long and how much pain were they having, prior alternative therapies tried, future alternatives of treatment that are available. The objective portion is functional outcomes to measure how much disability are they having at this time, what is their pain score, any orthopedic findings, palpation, what's their range of motion, and any orthopedic tests. And then we need to rule out indications with if there's already hardware in that joint, recent steroid shots, cancer history, or active or recent infections would kind of contraindicate having an injection at that time. You'll probably need x-rays of that joint so we can tell how much damage is being done by the arthritis or injury, to help predict what kind of success we would have. And based on history, objective findings, the testing that we do in the office here, whether or not you are or are not a candidate for regenerative therapy.
So a lot of people that I see already have x-rays, and we're talking about knees, but again, it applies to all joints. But if they don't have any recent ones, then we usually recommend getting new ones so we can do the best job. So x-rays are very helpful. Occasionally MRIs or CT scans are a good thing, but most of the time x-rays are enough to know what we need to know to see if this would be helpful.
Yeah, so some hardcore contraindications to these type of procedures would be an active cellulitis in the area that we would be injecting into, any known sensitivity to any of the products. If you have an artificial joint, we cannot use those type of injections. Hardware in the joint that you're coming in contact with for core site, any known sensitivity to DMSO, any active cancer within 5 years, if you're pregnant or breastfeeding, or if you are on anticoagulants such as warfarin or Xarelto, there is no evidence of increased risk of blood getting into the joint in the literature, so that's not a contraindication. Some medications, that we need to consider before we do these injections. If you're on NSAIDs such as ibuprofen, Aleve, tramadol, things like that, we would need to have you stop those for a period of time before we do that injection. Steroids, we need to wait at least 3 weeks before we do that. Tamoxifen, there's no contraindications to inject stem cells while on these medications. Biologics, there's no contraindications. That would be like your Humiras, Enbrels,
Or PRP.
and
Or PRP.
yeah, PRP. And hydrolonic acid, there's no issues, and so we can inject. And paperwork and flow, patient would come and see us for a consultation. A welcome guest packet would be given to you at the time of the lecture or after your appointment's set up. You'd have a consultation with myself in the office, and we would then assess and approve you for the injection. Health service agreement would be signed, and if the patient's Medicare, we must have to sign the ABN form. And
Because these things aren't covered by Medicare, so you just have to sign a form, so that informed consent again, that Medicare doesn't pay for these.
yeah, but I think don't pay for the injection, just the injection procedure, but not the product. And then we would write out the progress note and review and follow up, and sometimes we add on rehab treatments to help with the aftercare. Aftercare considerations, we recommend that you don't use any NSAIDs or Tylenol, Aleve, such as that for 2 weeks minimum. Ideally, it's best to be off at least 4 to 6 weeks. We don't want you doing any high impact activities for the first 2 weeks after the injections. And we encourage you to be moving around and with gentle range of motion, and we want you to be able to increase that blood flow to that area. Ice, we want you to use that sparingly. We want the anti-inflammatory process in your knee naturally to take over to help recruit more cells. Dry heat can be alternated with ice in cases of severe discomfort, and turmeric is a great natural anti-inflammatory product that doesn't interfere with anything that we would have injected. And follow-up care can vary slightly for each patient. And follow-up options, most patients are going to do great as long as we provide a realistic outcome and expectations up front. If you're not progressing as planned, there's a lot of options that we can consider to help you improve. We can add platelet-rich plasma injections up to every 2 weeks for 3 injections. There's hyaluronic acid series or a booster to help bring more nutrients back to the area. Voltaren gel, we can add that to help for pain relief. The turmeric orally, the chamomile or zeal injections often also help the joint. By eliminating gluten, dairy, and soy from your diet, that can also help. Weight loss if you're overweight, and referral to physical therapy that we can do here in-house, as well as bracing or splinting as applicable.
Yeah, some people who have a knee that's been wearing on one side for a long time, we can put a brace on them that makes their knee straighten out until we get that muscle and nerves rehabbed so that it does it on its own. So basically what we wanted to get through was just provide information so that we can just go over experience of hundreds of doctors, thousands across the country that we are in contact with and go to conventions with and learn from, as well as our own experience. We started again the first of the year to see if you would choose this type of treatment, and if you have questions, any questions that you have.
You've talked about knees.
Yep.
My problem is in lower back.
Okay.
Compressed discs, slip disc, and is a disc material considered cartilage?
No. So what we've used is use the injections along the spine, near the disc, not inside the disc, but to help the tissues around it, to get the ligaments, the tendons. See, discs are made of ligamentous type material, not cartilage type material. A disc is, the best way I can describe it is, here's two vertebrae and there's space between, and the disc is like a jelly-filled donut that sits there, and there's a kind of a ball in the middle of it called the nucleus, and it allows motion and turning of the two vertebrae to allow us to move and turn and bend, and that compression and decompression of the disc in movement, over time the disc wears down. And the average human loses about a ½ inch every day, and when you, of height. And then when you sleep, you gain that back because the discs pull in water and fill back up again, and as you stand during the day or sit, the weight of your body on those discs compresses them and pushes a little water out of them, and you get just a tiny bit shorter. And as you get older, I'm 67, they do get a little thinner than they were when you were 20. So what we can do is we do traction, which there's a table where you they're strapped in, and the table pulls the two vertebrae apart, which draws water into the disc, and then we can provide nutrients with injections near that and let that pull those nutrients into the disc to help heal it up. And that depends on how bad the disc is, which we can tell by x-rays or scans to see if that would be helpful for your lower back.
You pretty much answered my question. I've always thought that traction would be something you would use with these treatments.
Yes.
Mhm.
Makes sense to me.
So we can use them in most any joint. Like I said, I have my wrist done, elbow, shoulders, neck, back, hip, knee, ankle. And then she learned from the Orthobiologic Institute how to do tendons and anywhere.
Mhm.
Disc